There will be a resurgence of COVID-19 this fall. That coming from Toronto Public Health and city officials today. And with that definitive statement, a plan has also been presented, one that includes putting previous rules and restrictions back in place.
We will see resurgence. Amongst the best projections we've seen are those from the Centre of Infectious Disease Research and Policy, based at the University of Minnesota. They have described three possible scenarios. Scenario 1, a series of repetitive small waves that occur consistently over the next year or so, then gradually diminish over time. Scenario 2, a large wave in the fall or winter with smaller subsequent waves thereafter, similar to what was seen in the 1918-1919 influenza pandemic. And Scenario 3, a slow burn of ongoing transmission and case occurrence, but without a clear wave pattern.
While a gradual reopening and easing of restrictions has taken place as COVID cases began to decline, the city is preparing for what's to come. That means mandatory masks and distancing measures in public places will continue. Toronto Public Health is also expanding its case and contact tracing team, and multilingual rapid response teams are being put in place for high-risk communities.
We have made masks and face coverings mandatory on the TTC, inside public places like stores, and in apartments and condo common areas. Our mask policy is working, and it will continue.
The plan takes into account the colder weather coming this fall. Just some of the things mentioned include reverting back to free childcare for essential workers if needed, making recreational facilities available for food distribution and shelters again. TTC levels could be adjusted again based on use, while city buildings will remain closed. No mention of other closures, although many would be for the province to decide, or what exactly would trigger the moves. Dr. Davila emphasizing a few times that it's not a case of if that resurgence will happen, but when. And with that, she is encouraging everyone to get back to that bubble of 10 people or less if possible. She's also saying that when the fall time comes and it's time for that flu shot, to make sure you get one, this time more so than ever.